Warm good afternoon to one and all present here. I welcome each one of you to this webinar conducted by Transfusion Medicine Academic Society. Today's webinar will be an interactive session on various fellowships after transfusion medicine post-graduation. We have three experienced and eminent speakers for today's webinar who will share their views on how their respective fellowships in various subspecialties have made an impact in their professional career. This session will truly be beneficial to those looking to further their professional careers post MD or DNB in transfusion medicine. So take this opportunity to learn and plan for furthering your careers. I would like to invite our first speaker of the day, Dr. Siddharth Mittal. Siddharth Mittal has done MD in Immunohematology and blood transfusion from CMC Vellore and postdoc certificate course in cellular transplant immunology from Institute of Liver and Biliary Sciences, Delhi. Sir has worked as assistant professor in the Department of Transfusion Medicine, Tata Memorial Hospital, Varanasi, and currently working as assistant professor in the Department of Transfusion Medicine, AIIMS, Jodhpur. Sir has got multiple publications in various national and international journals and has also bagged multiple awards and presentations. We are so happy to have you here, sir. And now over to you, sir.
Uh, Thank you for such warm introduction. And I would like to thank Transfusion Medicine Academic Society for this opportunity and Dr. Rafi for giving me this opportunity to present on this platform. Can everyone see the presentation?
Yes, sir, your slides are visible, but you
Okay.
can make it at full screen.
Okay. Yes, I've done that. Okay. So I think the first important aspect which we should know is what are the after you anyone does MD or DNB in IHBT, what are the various factors on which our further decision making process is dependent? What are the factors? So for me, the most important factor which helped me decide what I should do after my MD was how did my MD training begin with? To how did it go? So what was the areas I was exposed to? What are kind of training I got, my mentors, all that had a big impact. Luckily, in my alma mater, I was exposed to various areas in our department, transfusion medicine. Apart from the basic transfusion medicine labs, we also had hemostasis lab and HLA lab in our department. So having those areas actually helped me a lot in deciding what I want to do further. And apart from that, we were posted in laboratory and clinical hematology for a very good amount of time. So all this actually helps in your MD training has a big impact on what you want to do. And further, once you do your MD training, it also depends on in the individual's interest area what he wants to do further. For me, after being exposed to various areas of transfusion medicine, I was keenly more interested in transplant immunology. Thanks to my training in Vellore under the guidance of Dr. Dolly Daniel, ma'am, I had an interest in immunology, learning more about transplant immunology, and therefore I was looking for fellowships in this particular area after my MD. I had the opportunity to do 1.5 years of SRship further at Vellore, during which time I learned in detail about their chili techniques and their interpretation. But after that, also, I wanted to do further in this area. And I think the third reason which anyone should consider is how much risk one can take. Our branch, transfusion medicine, actually is a new branch as compared to other branches, and therefore there's always be some amount of risk when we want to go for a new course. And I think that we should take risk, because even if it's a matter of 1 year, 2 year, at the end of it we will learn something. So a risk appetite should be there. And finally, one's future plan also dictates how what one chooses after MD. Some people prefer to work in a corporate or private institute. Some people want to join a academic government institute or central government or state government institute. And for me, it was always that I wanted to be in an academic government institute. But still, I had to, once I came to know about this PTCC course, I went for it. So before I actually go into the details of my PTCC course at ILBS, I would first like to highlight what is the importance of immunology in our transfusion medicine training. So the next slides is actually importance of immunology in transfusion medicine, and I am just quoting what is already mentioned in the guidelines of our curriculum of MD IHBT by NMC, National Medical Council. So in the if you go through that in the introduction itself, they have very clearly mentioned. I have highlighted the line that because transfusion therapy has strong interrelationship with several
Hello,
other
sir.
disciplines. Yes,
Excuse me, sir. Your slides are not visible.
not visible.
Yes, sir.
Once. Okay. Okay. Is it visible now?
Yes, sir.
Okay. So these are the guidelines from National Medical Council about our MD curriculum. And on the first page itself, they have highlighted how important immunology is. The line says because transfusion therapy has strong interrelationship with several other disciplines, particularly hematology and immunology. Training programs in transfusion medicine must include appropriate knowledge and skill in these subjects. Further, the NMC has given a specific learning objective, and the first is basic sciences, which includes immunology, medical genetics. We should understand, they have further mentioned that we should have the understanding of physiology of immune system, transplantation immunology. We should be well familiarized with the scope, principles, and limitations, interpretation of important procedure. And these are the list of the procedures they have given, but it is not limited to them only. It is HLA typing, hybridoma technology, isolation of T and B lymphocytes, CD4, CD8 count, macrolymphocytotoxicity, SS, cellular SS. It also stresses that a transfusion medicine specialist should know the nomenclature, organization, polymorphism of HLA complex, and they should know the role of HLA typing in organ and stem cell transplantation and also with association with various diseases. We should have demonstrate proficiency in performing various laboratory immunological tests like isolation of T lymphocytes, flow cytometry, CD4, CD8 counts, HLA typing techniques, which I have already mentioned, nucleic acid assay, microcytotoxicity assays, and we should be well versed with PCR, Western blot hybridization procedures. The syllabus itself in NMC has a separate section on immunology. It has a separate section on modern biological techniques, which includes SSP, SSOP, Western blot, animal experiments, proteomics. What I and finally in the theory examination also the paper one should, which covers basic sciences, basic applied aspects, should have questions on hematology, immunology. The paper two is based on immunohematology, immunogenetics, which should include molecular biology and HLA. So my purpose of actually telling all this means showing all these slides is actually that there's a NMC itself is mentioning that immunology, especially transplant immunology, has a big role in transfusion medicine. It has, and we need to be proficient in it. Unfortunately, I do understand that many centers still don't have HLA lab in where MD courses are running, but we should, I think, always try to ensure that our students at least get postings, even if they're external posting outside lab or any other hospital where HLA lab is running, so that they get exposed to these areas. The NMC has itself suggested how many months of posting. So if you have, we had flow cytometry and HLA lab together. So 2 to 3 months posting is what is minimum required during a MD curriculum. Finally, I would like to mention that immunology, especially transplant immunology, is one of the subjects of our specialty IHBT, and it has the potential to further evolve as a subspecialization. With this, I think I'll go to the second part of my presentation, which is details of PDCC course in cellular transplant immunology at ILBS New Delhi. So first, the eligibility criteria, which is mentioned in the advertisement always, is MD DNB microbiology slash hematology or PhD in immunology. And this is an error, means it is well known that there is no MD DNB hematology, it's a DM. So MD DNB IHBT is considered eligible. they will hopefully revise this in the next advertisement. Once we apply for the course, the selection criteria is first we have to clear an entrance exam which is MCQ based. Minimum 50% marks are required to qualify this exam. Only if and when we clear this exam, will be eligible to do for a departmental assessment and final interview. The weightage is 70% for entrance exam, 30%. Once these two things are done, then only then the actor's interview take place and the result is out. But we have to clear the entrance exam first to go for the interview. And it offers a handsome monthly stipend of at SR level. It's a SR PDCC course. So approximate grade pay 6600 and other allowances. It approximately comes around 1 lakh per month. The course fee is around 80,000 for the PDCC course, and out of which 20,000 is refundable. The syllabus of this course is actually divided into three sections. It mainly involves the first is basic immunology, transplant immunology, the second section, and third section is immunohematology. Some of the topics under each section I have mentioned. This is not the complete list, but yes, many topics which are included in the syllabus of this course. So the training of this course is actually, I would like to say that this is an interdisciplinary academic course in the subjects immunology, transplant immunology, and immunohematology, all of which belong to the specialty IHBT. The academic training during this course is jointly imparted by Department of Molecular and Cellular Medicine and Transfusion Medicine. We are supposed to take many lectures and we are supposed to attend many seminars during this course, along with taking journal clubs, which and all this happen on a weekly basis. There's a lot of bedside training involved, which includes DNA isolation technique, gene expression, cell separation, neutrophil and T cell sorting, monocyte macrophage adherence assay, immunophenotyping, learning about doing and learning functional assays, and definitely HLA typing and CDC flow cross matches is all what we learn during this course. During clinicals, we are posted in transplant units for doing clinical rounds, ICU visits, performing therapeutic plasma exchange procedure, and also to monitor liver transplant and renal transplant recipients. ILPS caters to liver transplant and also renal transplant. So immunological monitoring of transplant recipients also we used to do while we were posted, which simply means suppose if we want to measure HLA-DR expression on monocytes, then we have to follow up that person, the HLA-DR expression during the course of the transplant, from the pre-transplant to the post-transplant phase, and that is what sometimes immunological monitoring entails. During this PTCC course, it is mandatory to do a short-term intramural thesis research project, without which you are not eligible for the exit exam. You have to do the thesis research project. You have to submit a report. Only then you can go for the exam. The exit exam is like any MD exit exam. It includes instead of four question papers, we have three exams here, which are of three durations each, spread over 3 days, and they are again based on basic immunology. Paper one, paper two being transplant immunology, and paper three being immunohematology. This is followed by a practical examination in which two external examiners come, and there are 2 to 3 internal examiners. So this is a very well comprehensive and structured course, I would say. And the significance of this course, finally, the third part of my presentation, is that it actually led to enhancement of my knowledge and skills in transplantation immunology a lot. As I already mentioned, I learned a lot about HLA techniques under the guidance of Dr. Dolly Dean and Valor. But there are here I actually learned the cellular aspects of transplant immunology, how to do flow cytometry, how to do cell sorting, how to analyze the cellular interactions, how to do functional assays. So, and I was interested, keen in this area, and therefore it has helped. And I'm lucky enough to apply these skills in my practice also, where I was working earlier at Tata Memorial Hospital, Varanasi. I established a small HLA lab there based on my training, and we started with PCR SSP typing of HLA typing. And currently at AIMS Jodhpur, we are involved in various research projects using flow cytometry. Due to this PDCC course, it definitely led to my CV improvement because I had got a certified course in transplant immunology from one of the top teaching institutes in the country, and I'm thankful for this opportunity that I could take it, and also for my all the mentors at ILBS. I would like to acknowledge first my faculties at Vellore, Dr. Dolly Daniel, Dr. Joy Ma'am, and Dr. Sukesh Nair. Then at ILBS, I would like to thank Dr. Nirupama Trihanpati, who is professor, course coordinator, and course supervisor for this course. Dr. Meenu Vajpayee ma'am, who is course supervisor for this course, and Dr. S.K. Serene sir, who under whose vision this course was developed, and sir is senior professor, vice chancellor of ILBS. So my sincere regards and acknowledgement to all of them. And I think this is a brief presentation. I'm thank you, and I would like any questions. I'm open to them.
Thank you, sir,
Thank you, sir.
for that excellent presentation.
Thank
If
you.
anyone has any query regarding what sir has discussed now, kindly raise hand or type your query in the chat box. If there is any query, you can raise hand or type your query in the chat box.
Mm, I can see a
So
question.
there is one query from Dr. Rishi Mathur.
Yes.
Is
So is
this
this?
course oriented more towards clinical side or lab side?
So yeah, this course is more oriented towards laboratory side because we are actually posted many times in the laboratory to learn flow cytometry, cell sorting, functional assays. But definitely there are postings in the transplant units, in renal transplant unit, liver transplant unit, and we have to take regular rounds with the consultant and faculties on daily rounds of the patients who are undergoing transplant. So, also therapeutic plasma, while we are posted in the Department of Transfusion Medicine, we are involved in therapeutic plasma exchange procedures. But definitely, this is more of overall, if one has to say, little bit, it is more into towards lab side. You get to learn about various laboratory techniques. But it's not isolated laboratory. You have to have a mixture of both. So, but the strength of this course is you get to learn many techniques. So, yes.
So one more query by Dr. Pratik. Any other institutions providing the same course besides ILBS and
So
any international fellowships in the same specialty?
yes, so as far as I know, in India, I came across only this course in transplant immunology. Yes, outside in there are many courses in USA. The most prestigious one being by UCLA, Transplant Immunology Fellowship. That is one of the very regarded fellowships if one wants to go. That's a 2 years fellowship course, and it's a good course. And there is another universities in USA. They're offering transplant immunology fellowships. So definitely outside India there is scope. In I have looked into USA particularly. I found UCLA, University of Chicago, and Toronto. I think they are also offering.
I think there are no more queries. Thank you, sir.
Thank you.
I would like to introduce the next speaker of the day, Dr. Gayatri Kaduvatti Chellaya. Dr. Gayatri has done MT in Immunohematology and Blood Transfusion from Dr. MGR Medical University, followed by Fellowship in Apheresis Medicine from Malabar Cancer Center, Talasheri, and Fellowship in Laboratory Hematology from Christian Medical College, Vellore. Madam is now working as junior consultant in immunohematology and blood transfusion at Christian Medical College, Vellore. Over to you, madam.
Thank you for the kind introduction, Sharon. Am I audible?
Yes, madam.
Okay, thank you. My screen is visible.
Yes, madam. Your slides are visible.
Okay, whether it is in slideshow mode.
No, madam.
One second. It will take quite a time, I think so. Before starting this, whatever I want to say, Dr. Siddharth had clearly explained you like how to go about in fellowship after your transfusion medicine. So you have to check like basically the same thing, like what you have learned during your PG period and what are the things you are lagging and how you can gain this knowledge, because the quest for knowledge is very high. Like you have, because this is an emerging field, like not every institution is supposed to have the privilege to have all the sort of testings or treating patients, everything. So there is, like we don't have DM courses also after our transfusion medicine. So this fellowship courses are some opportunity to gain extra knowledge in the field of transfusion medicine. I think whether my slides are visible till now,
Yes, madam. Slides are visible.
but not in the slideshow.
Yes.
Okay, it's some problem I think because the network issue is there. Anyway, I'll continue with this thing.
Okay.
If it's still not visible after some time, please let me know. Okay.
Sure, sure, madam.
Okay, so this first I'll talk about my fellowships, what I had done, and in the end I'll tell what are the things that actually helped me. First, I'll talk about my fellowship in apheresis medicine. Why have I chosen fellowship in apheresis medicine? Because as I told, not everybody is privileged with all sort of facilities. I thought like apheresis is a developing field in the case of transfusion medicine, so I need to have more need to know more about this apheresis with the machine learning. I thought that will helpful. So I did this fellowship in Malabar Cancer Center. It's a beautiful place to work there because the ambience is very good. Where you can, it's located in Talasheri. It is this Malabar Cancer Center considered the institute of Ministry of Health and Family Welfare under the government of Kerala. And it's look, I told you it's located in Talasheri and it is a 200 patient inpatient bed. Mostly they will treat this medical oncology, surgical oncology, and hematology patients. These are the patients load actually in Malabar Cancer Center. Actually, I want to show you the team that I worked with in Malabar Cancer Center. Dr. Mohandas is head of the department in transfusion medicine in Malabar Cancer Center. He's such a cool and composed person to work with. Everyone should get an opportunity to work with him because
Excuse me,
the,
madam.
yeah,
Your slides are not moving.
yeah, that one because still it is in. One second.
Still is in the first slide.
Okay, can I stop sharing and reshare?
Sure, sure, madam. Yeah.
Okay, sure. Now it's visible
Yes, it is.
in the presentation mode, no?
Yes, madam.
Okay, sure.
Okay.
So this is the ambience I told you, no, this is a wonderful place to work with. The ambience is itself, it's like very good. As you know, Kerala is God's own country. The place is such a nice place. And as I told, this is a brief introduction about Malabar Cancer Center. This is a wonderful team I worked in Malabar Cancer Center. And he is Dr. Mohandas. He is the head of this institution. As I told, he is a very cool and composed person to be worked with. Everyone should have get an opportunity to work along with him to how to apply to this course. So the website is www.mcc.kerala.government.go.in. When you go to this website, you will have this page of this MCC where you'll see the news and updates. When you down scroll it, you can see the carriers. In the carrier section, you will like whatever notification is coming, you can see there and you can apply for this. What are the educational curriculum, like prerequisites for applying this? So number of fellowship positions will be 2 per 6 months and fellowship duration is 1 year, usually two sessions, January sessions and July session. And then eligibility will be MD transfusion medicine, DNB transfusion medicine, MD pathology, DNB pathology, and DCP in clinical pathology, like DCP itself, diploma in clinical pathology. So course-wise, what one has to learn, one will be learning from apheresis, this apheresis fellowship. They will knowing about fellowship like blood center with an apheresis. If, as I told, apheresis is a developing thing, so you'll be in donor related like platelet pheresis, plasma pheresis, peripheral blood stem cell collection, and the cryopreservation, because not all institute are privileged with this stem cell collection and cryopreservation. So it's a great opportunity, like you can go and work hands-on. You will be doing this thing, because this center is mainly medical oncology, hematology patients will be there. And then if opportunity, some leukapheresis also you can have. As I told, medical and surgical oncology patients only, the possibility of therapeutic asthma exchange in the institute itself, it is realized, but you will be posted outside for training, because it's an fellowship in apheresis. And other than apheresis, what are the things you are going to learn in this department is, one is flow cytometry. Flow cytometry is also like, you would be thinking why I should know about flow cytometry. Flow cytometry is now emerging in the field of transfusion medicine. As Siddharth said, HLA, one of the typing method, like cross-matching technique is flow cytometry. So we have to know in and about. So only you will be knowing about the troubleshooting when something arises. And then HLA testing. Here also I had HLA testing, this thing, orientation. And then they will have a posting for hematology for 1 month. In this 1 month, you will be seeing all sort of hematology cases, like benign to malignant, and then your coagulation disorders. Everything will be coming. It's an This hematology team in MCC is also a very great team under Dr. Chandran Nair. It's a great opportunity to work along with them. And another one thing I learned in fellowship is publishing a paper. Publishing a paper is not a simple thing. It's an art. You have to have so much thing in your mind. Like you have to know about your statistics, and you have to know what you are doing in your paper, because so much research opportunity is there. Dr. Mohandas sir is a epitome in this publishing his paper. With his help, I published 6 papers along with him. He's a great mentor, and everyone will have a great opportunity if you are going to work along with him. And another one interesting thing I find in Malabar Cancer Center is this multi-specialty board meeting. Usually they will have in the evening hours. What they will do, they will come up with different cases, like whatever cases they had, and they will be discussing with the other specialties, and they will come to one conclusion. It is not like a single unit taking a single day, because we will be giving this consultation, like from we have to get an opinion from other specialty, but this multi-speciality board will help in doing that everything in a single hand. So they will be taking everyone's opinion into consideration and come to a treatment protocol for that patient. So what actually in this one, you have to maintain one logbook. This is mandatory, and thesis is also mandatory. Before going for exam, you have to send that publication, like a thesis for publication. And then there will be an exit exam. As like your PG exam, you will be having for theory for 100 marks, and practical, I had it for 2 days. Mostly one internal and one external. It's a great opportunity to work. So this year, planner for this course, there is this year July session, last date for application is 15th July. If somebody is willing to apply, you can go to that website and you can apply there, or contact any of us. We can guide you through this. And next is the fellowship in laboratory hematology. How I applied this fellowship in lab hemat? Basically, again, my mentor, Dr. Mohandas, helped me in applying through this fellowship, because initially I thought of applying clinical hematology. I'm not sure of this lab hemat part. He only told me, like, this is an evolving field. You should have some knowledge, because if you apply, you are the first person going to apply from transfusion medicine in laboratory hematology. I thought I'll give it a try. Sir is such a mentor, like help you in every aspects of your life. And I did my fellowship in lab hematology from Christian Medical College, Vellore. It needs no introduction. And this is the beautiful team that I worked with. In fellowship, your mentor will be Sukesh sir. And how to apply to this course? This website, admissions.cmcvellore.ac.in, you can watch in, where you can see this page. In this one, medical doc postdoctoral fellowship course. When you click this one, you will be taken to this page where you can see different sections, where you can give this download admission bulletin form, where the full details of this administration process, how to apply, what is the course fee, and how what kind of stipend or accommodation, everything will be in the brochure, and you can go through it. What prerequisite is for this course? Like it's a 2-year course and it's in 2 per year fellowship. Commencement of course is based upon your notification only, because it may vary. And eligibility criteria: MD transfusion medicine, MD pathology, and DNB pathology. In curriculum wise, what one has to learn when they join the fellowship course? First one is the blood bank. In blood bank, variety of cases will come, because we might have read some cases that we won't see in our routine practice, but we can see most of the unusual cases here, like hemophilia with inhibitor. When they are going for an surgery, how will you manage? Like the different sort of cases you can see in a blood bank posting. And then comes a laboratory hematology. In lab hemat part, you will be seeing peripheral smears and the bone marrow. Bone marrow mainly the aspirate things. Here you have the privilege to report under end pathologist, so you will have a basic knowledge about how the cells it is coming, what is the pathology behind, what are the conditions, like that you can do. And coagulation, I think coagulation should be a part of every transfusion medicine curriculum. Not everyone is having a coagulation lab. It is only few institutes in south side, I would say. One is CMC and another one is Jubilee Mission Medical College, I think so. Both of them having a good coagulation setup. Everyone should know what is happening in coagulation, because we are issuing FFP in left and right. We should know why we are issuing, how this parameters will change everything, because most of the coagulation, one would say 70% of the errors, like abnormal results in coagulation, is due to laboratory parameters. So when a decision making is coming in case of an FFP, if you know in and out of an coagulation only, you will know how to issue an FFP. So this helped me much, I would say. Then general pathology, you will be seeing your triphines and some lymph nodes where the hematological cases is being involved. And in HLA, Siddharth had told, like it's a great opportunity to work with the HLA team. You'd be knowing in and out of the HLA. Then cytogenetics. Why the cytogenetics and molecular genetics one has to know? Because you will be dealing with disorders like thalassemia, sickle cell anemia. How then you will be transfusing your leukemias, acute leukemias, lymphomas, everything. You should know how it has been diagnosed, because the diagnosis part, if you know, it's like you are the quest for knowledge to know about in-depth about your disease is, I think it's important for knowing everything. Then flow cytometry. Here we had a separate 1-month posting in flow cytometry. All sort of leukemias, again leukemias, lymphomas, your primary immunodeficiencies, everything, like how the diagnosis is made on the flow cytometry, what are the markers. Here it's a center of excellence for flow cytometry. So you will have a wonderful experience in the flow cytometry laboratory. Then you will have this clinical hematology, again 1-month posting. I couldn't attend because of COVID, that issues. I couldn't able to attend, but clinical hematology is also like, you'll have a nice experience. Next person, Dr. Vikram, will be giving an overview of your this clinical hematology. And you have an opportunity to visit other fellowship courses, like lab hemat fellowship courses, which have been provided in other institutes. Then here thesis is optional, but I would suggest you to use this opportunity to publish a nice paper, because so many things, whatever you are reading in your book, that extra advanced techniques are available here, so you can make utilize of it. And then again here, like PG exam, you will be having a theory paper and practical. Practical, mostly you will be having your coagulation, peripheral smear reporting, and bone marrow. Along with that, Viva voice, everything will be there. This is the year planner for this year of for CMC. 3rd June is the last date for submission online application, and 8th June will be your last date of supporting documents. So if somebody is interested, can log into this website and they can apply for this course. So whether the fellowship improved my personal or professional or personal life, this question always comes into my mind. Whether I should, I will think whether I should put the question whether. No, I should put the question how, because as everyone can see, it's obviously improved my personal and professional life, because I did my PG from Dr. MJR Medical University. Sometimes I felt I've been neglected in most of the, I don't want to say that one, but sometimes I felt like that. So these fellowships actually helped in my personal life. What about professional life? Because I had an opportunity to work with these great peoples who are an epitome in transfusion medicine. And now the patient blood management is evolving as a new, like everybody is moving towards patient blood management. So I think these fellowships had helped me to carry over with this patient blood management. So success is not an overnight story. So keep thriving for knowledge. Thank you for this wonderful opportunity.
Thank you so much, madam, for that well explained presentation. If anyone has any query regarding what madam has discussed now, kindly raise hand or type your query in the chat box. Madam, there is one query in the chat box.
Yeah. Next
How is
speaker,
clinical
Dr.
hematology in CMC Vellore?
Yeah, next speaker, Dr. Vikram can give you the answer for this, I think so, because next one he is going to talk about that.
Yes, madam. Any other query? I think there are no more queries. Thank you, madam.
Thank you, thank you.
Madam, there is one more query. Is DNB transfusion medicine eligible for
Yeah,
lab
DN,
hematology?
yes, DNB transfusion medicine is eligible. It is not set, but you can apply.
Okay, madam. One more query. Do DNB immunohematology and transfusion medicine eligible
Yeah,
for
yeah, they are
fellowship?
also eligible, but it is not in the brochure, but you can apply.
There are no more queries, I think. Thank you, madam.
Thank you, Dr. Shah.
Let me now introduce the last speaker of the day, Dr. G Vikram Kumar. Dr. G Vikram Kumar has done MD in immunohematology from JIPMER and has worked as consultant in transfusion medicine at Yashoda Hospital, Hyderabad. Sir has done fellowship in clinical hematology from CMC Vellore and is now working as senior resident in the Department of Hematology at ESI Hospital, Hyderabad. Over to you, sir. So you can share your slides now.
Am I audible?
Yes, sir.
Yes, I didn't prepare any PPT, so I thought I'll just share my experience with regard to the fellowship in clinical hematology. So first of all, we should thank Transfusion Medicine Academic Society and Dr. Rafi, as many of the young transfusion medicine specialists are in dilemma, like what is the fate of this specialty. So after finishing after finishing my MD in immunohematology and blood transfusion from JIPMER in 2017, I started working as a junior consultant in one of the private hospital in Hyderabad. Like every one of you, I was also looking for opportunities like for higher education, but at that time there are only one or two options. Like if I remember correctly, one is from the Malabar Cancer Center, the fellowship in clinical hematology from Malabar Cancer Center, which was there at that time only for 1 year. The course duration is for 1 year, and second is fellowship in FRSS medicine from JIPMER. So at that time in April, CMC Vellore, Christian Medical College Vellore, has started its first fellowship program in clinical hematology in April and May 2020. That was the first time they have started the program. Probably the reason will be like there was 1 year where there is a no DM admissions in CMC Vellore across all the specialties. So in need of manpower, they have started the fellowship courses. So in 2020 was the first time they have first batch they have started this fellowship in clinical hematology. So CMC Vellore being one of the topmost institute for hematology services, and also the fellowship duration is 2 years, which I felt like probably the adequate duration. Instead of 1 year, 2 years is a probably adequate duration where you will be exposed to the lot of things and you'll also understand. In 1 year, I think it is very difficult once you are in a non-transfusion medicines for 3 years and coming to a clinical side again. 1 year will be very little time. You need at least 2 years of time to understand. So that made me to choose CMC Vellore over Malabar Cancer Center. So after applying for the course, there was a MCQ based online exam was there. So then after that, around 35 to 40 people will be selected and they will be called for the interview. So in interview, on the day of interview, you'll be having around 10 spotters, and after that you'll be having an interview. With regard to the MCQ based online exam, I prepared rather, I prepared from Harrison's. There is a hematology chapter, hematology section will be there. So, and that one more book will be the Rossi's Principles of Transfusion Medicine. Both are I felt good enough to clear your theory exam. And also spotters will be there around 10 spotters will be there on the day of interview, followed by a one interview. So there will be 5 to 6 panel will be there, 5 to 6 doctors will be there, faculty from hematology, faculty from transfusion medicine, faculty from lab hematology. So they'll also be in interviews, also they'll be asking a few clinical scenarios, one or two clinical scenarios, and most importantly they'll also focus on like what is your idea behind taking this course and what do you want to do with this course. So after finishing the interview, so there are almost 6 people were selected for the course, and uh, out of 6, 5 were from the transfusion medicine on that year. So and one from the pathology. So coming to the training, with regard to the training, I must say that there is no difference between the, at least for our batch, there is no difference between the fellowship in hematology and DM in clinical hematology for our batch. So 2 years of fellowship, I must say it's very much challenging both in terms of physical and mental stress. Physical because you end up doing night duty every third or fourth day, which will go on for 36 continuous hours. So, and also there will be hardly any holidays. So you will be working for almost every day. And also mentally also it's a kind of stress because you are always in a, you will be seen in a separate entity because you have come from a non-clinical background. And you will be expected to learn things faster. So that also a mental stress will also be there. So what I'm trying to say is that it is not an easy fellowship. uh, it is not at all an easy fellowship. Definitely it's challenging in terms of both uh, physical and mental stress. So with regard to the few more things like accommodation, the hospital will be provided, hospital will provide the accommodation, and they'll be providing some 40,000 stipend after all your deduction. But coming to main important training point of view, so you will be exposed to all sorts of cases, simple anemias to complex haploidentical transplants, second transplant, mud transplant. You will be exposed to everything in your 2 years fellowship course. For the initially, you will be asked to work under a senior, and subsequently, with when your work is good, when you are able to cope up with all the procedures, when you are able to cope up with all the workload, you will be given a senior post at least in second year. So that all lot depends on how you are working there. So it is not at all easy. You have to take a lot of physical and mental challenges. Then if once you have become a senior, then the sky is the limit for your learning, because there is a lot of things to learn. And so once you are in a senior position, like you will be learning more. If you are uh, the senior, junior and senior, once you are in a second year, if you are given in a senior post, a lot of things can be learned. And second is the, I feel that 2 years fellowship in CMC Vellore is what I personally feel is almost equivalent to 3 years of DM course elsewhere, because that much is the workload. You always have almost 100 to 120 inpatients, and also 20 18 to 20 transplants going any point of time. So that much is the workload. So that's why I feel that it's almost equivalent to the DM course elsewhere. And also for us, we were lucky that there were no DMs when we joined in 2020. So in 2019 there was no DM batch they have joined. So there is a manpower scarcity was there. So we were exposed to all kind of cases, lymphomas, leukemias, benign, malignant, transplants, everything. So as a part of uh, training, you will be given 3 months of transplant ward also. So for us, we were lucky that there was no DM, so we were trained much we were exposed to lot of cases and transplant cases precise more. And also uh, this may not be possible with the newer batches, because now the Vellore has CMC Christian Medical College Department of Hematology has almost a lot of number of DM candidates coming every year, and also fellowship candidates are also coming. So the number of people have increased. So I don't think the same exposure, same level of because of the second year you should take that senior post. If you're not taking that senior post, if you're working 2 years as junior, then it's not worth of doing this course. So you should uh, you should take that senior post. With lot many people coming there with lot DM candidates, fellowship candidates, maybe I feel that this might be difficult for the newer batches. And also one good thing about CMC Vellore is that you will be trained in both pediatric and adult clinical hematology. So both pediatric cases you will see, and adult cases also you will see. That is one good thing about doing fellowship in CMC Vellore. And one more important thing is that uh, you will be trained under some eminent personalities like Alok Srivastava, Bijus George, Vikram Matthews, A.B. Abraham, who are like very very well experienced, and you will be trained in all sort of managing coagulation disorders. And because coagulation disorder, I'm specific because not all centers are dealing with the coagulation disorder, especially hemophilia patients, hemophilia A and B, and hemophilia patients with inhibitor. And more importantly, the complex surgeries will happen in CMC Vellore. I don't think any other center, in my knowledge, will do such a complex surgeries except CMC Vellore. So all these things will be exposed to in CMC Vellore. So with regard to the exam, there is a proper once you finish your 2 years course, there are 1 month of peripheral posting will be there, where you will be trained for flow cytometry, and bone marrow aspiration and biopsy. I don't feel the 1 month is a very short duration to learn about the bone marrow aspiration and biopsy. Flow cytometry, yes, definitely you can get a knowledge for if you work there for 10 days. So coming to the exam, once you finish the course, there is a proper theory and practical. Because of COVID, we had only theory and a grand viva, but they have designed an exit exam where you have a proper practical exam where you have a short case, long case, spotters, everything will be there. For us, it could not be done because of COVID. So after finished course, I joined ESI hospital. Here there was no hematology department to start with, but we as of now established some 20 bedded hematology ward, and we are dealing with both pediatric and adult cases. Few of my colleagues are also there who are practicing, who are after finishing the course, practicing as independent consultants. And one of my colleagues is also seeing both blood bank and hematology cases. So it's definitely a lifetime experience, which is definitely worth of doing if you are physically and mentally strong. Because I have seen many people who will come and they'll stay for 1 to 2 months and they can't bear the stress and they will leave. So if you feel you are strong physically and mentally, then definitely I probably recommend this clinical hematology course from CMC Bangalore. Thank you.
Thank you, sir, for that informative talk. Your queries can be typed in the chat box. So there is one query. So are we eligible to practice clinical hematology as a private practitioner after doing this fellowship?
So there are no guidelines on this that you can't practice, but so far that's what I told in my last statement, that few of my colleagues are already practicing as a private consultant. One of my colleagues is also looking after both blood bank and hematology cases.
Another query. Can you briefly tell us about a normal day in a clinical hemat fellow's life from the start of the day to its end?
Okay, fine. So day starts at 7:30 to 8 in the morning. So you, you have to do your rounds first. Then once you finish your seeing your cases at probably 7:30, you should start that to finish your cases by 8 o'clock. 8 o'clock on a normal day, 8 o'clock the consultant will come for rounds. So rounds will go on for at least 2.5 to 3 hours. So by 11 you finish your rounds, and during the rounds a lot of work will be given. Each case further work, bone marrow procedures, central line insertion, lumbar punctures. So that work you will finish after rounds, maybe after rounds, and subsequently uh, at around 3 o'clock or 4 o'clock, you again have to go to the consultant who has done the rounds to explain what has happened to the morning work. So, what is the status of reports? What is the status of for investigations on that day? So, once then there will be further management will be decided. In meantime, uh, you will be having new cases in your ward. So after 4 o'clock, you will go back to your ward and you will see the new cases again, and you will be making a plan for the new cases. And so that will take at least for 2 to 3 hours. So around 7:30 to 8 o'clock, you will give final handover to the consultant who has done the rounds in the morning. So what is the final status of that patient on that day when you are leaving? And also, if there is any further follow up to be done, that you have to hand over to the doctor who is on duty on that day. So that guy will follow the reports. This is a normal day when you don't have a OPD. Suppose if you have a OPD, you have to finish your rounds, you have to finish your rounds work, and you have to attend your OPD. So it's a quite hectic day. You'll hardly get any time. So it starts with around 7:30, and you probably will end up, if everything goes smooth, you'll go back to home at around 8:39. On a OPD day, it will go up to 10 o'clock in the night. And if it is your night duty, you will go home only after next day, 8 o'clock or 9 o'clock. Dr. Sharin?
So, one more query. Are we eligible for FRCP in transfusion medicine?
I'm not sure about that. I think some either Gayatri or Siddharth should, if they know, they can answer this. So there is one more option. Any other place that where we can do fellowship in clinical hematology having 1 year course? I'm not sure, but just check with Malabar Cancer Center, Thalasri, Kerala. Uh, I think they are offering 1 year course. Maybe I'm not sure. Now they have changed it to 2 years or so. And I recommend. I just say that 1 year is not definitely not uh, sufficient. Basically, to understand clinical hematology itself will take 1 year. And so 1 year I'll definitely not recommend you. And please go for the 2 years fellowship. So with regard to the
Vikram?
preparation, yeah, yeah. Yes, sir.
Sorry, you continue, please.
Yes. With regard to the preparations to be done in books and read for the exam, that's what I told in my talk also. There is a section in Harrison's on hematology. I read that, and also I feel that Ross's principles of transfusion medicine. There is a clinical transfusion medicine. There is a whole section is there. Please go through that. That's a very nicely written. So that is also useful. I read these two things, and it was quite sufficient to clear the MCQ based questions.
So,
Infectious
next
disease
query.
specialist available at yeah, I'm just reading. Infectious disease specialist available at CMC, or we have to look after infectious disease during the neutropenic phase. Yeah, so definitely. So there is a ID team is available. There is an disease department, which is one of the best department. So they are available definitely. But all neutropenic phase cases, we will be admitted under us, and we will be taking the prime. We will be the primary team to look after them. And in case of any queries, then only the ID team will be helpful. Any case in a normal febrile neutropenia, ID team is not involved. In exceptional cases where you are not able to find the organ is source of infection, or if there is an unexplained fever, and or if you want to know what is the exact duration of antibiotics to be given, you can always give a consult to the ID team, and they are really great. Is this course still open for MD TM candidates? I heard that recently they have reopened, they have made transfusion medicine again eligible for this course. Please tell opportunities in abroad. I'm not very sure about this thing.
Hello?
Yes, sir. Yes, sir.
Now, Vikram, did you say that there is some guidelines on whether fellowship students can practice or not?
I said there are no guidelines that you can't practice.
Okay, you said there are no guidelines.
No
Okay,
guidelines that you
fine.
can't practice. No, because that's what there is a. If you see ESI where I work, if you have a
Hmm.
5 years experience after you finishing your MD degree, you are eligible for a junior consultant post.
Okay.
So, 5 years in that super specialty department. So now I finished 2 years in CMC Vellore. Now again I'm doing for 3 more years. So probably I can join as a junior consultant after that.
Okay. So only institutional based, it may be little tricky.
Yes, yes. But
Yeah.
outside, definitely there are. I don't see any thing that you can't practice also, sir. Because
Okay.
our colleagues, Dr. Sridhar, Dr. Arshad, are already practicing as a independent consultants.
Yeah. Thank you for clarification because I heard there are guidelines. It's not.
No,
There
no,
are
no.
no guidelines. Okay. Okay.
So, how many waitlisted candidates after the interview are likely to get in? I see it varies from year to year. For in our when we gave exam, so there are almost 8 people were selected, and of them were joined. So none of them left the course. So it all depends on how many of them will be. All depends on that year how many wants to join, don't want to join. So it depends. Some people will join and they will not be able to cope up with the stress and workload, so they will leave. So depends on that day, that years how people are there. So, any more queries?
I think there are no more queries.
Yeah.
The video will be provided, the recording will be provided in the YouTube channel. Thank you, sir. I now request Dr. Abhishek for vote of thanks.
Uh, Thank you, everybody. First of all, I would like to congratulate, of course, the team that has roped in three young people who have slightly advanced after MD transfusion medicine. It was nice to hear from their own words who have undergone this training and the good things as well as the hardship that they faced during the this one, and also their success stories beyond the fellowships. All three speakers, I would take time to thank Dr. Siddharth, Dr. Gayatri, as well as Dr. Vikram. Thank you all for your time to just enlighten the junior enthusiastic people of the branch. Thank you very much. Thank you.
Thank you, sir. With this, we have come to the end of the webinar. I hope today's session has enhanced our existing knowledge regarding various fellowships after transfusion medicine post-graduation. Kindly submit your feedback through the link that is provided in the chat box. Your suggestions are most welcome and are valuable to us. Thank you all and have a great evening.